Hey guys, this is Public Health Talks. I'm Dr. Bidmas, and on today's show, I'm going to be talking about poor hygienic and unsanitary abattoirs, a threat to public health and the environment. And on today's show, I have Dr. Janet Amosu with me to help facilitate that discussion. So, a brief bio of Dr. Amosu. She is a doctor of veterinary medicine. She served as a meat inspection officer during her youth corps, and she's currently pursuing a master's in veterinary public health. So welcome to the show. So I am glad you're able to join me today to talk about this topic.
Thank you for having me.
Yes. So it looks like this topic is something that you're familiar with, so it's something that you're obviously passionate about. You're a vet, and according to your bio, you as part of your youth corps, you're a meat inspector officer, right? And I assume that you've seen or you saw firsthand what usually go behind the scene when it comes to meat processing and abattoir, like the sanitary or the unsanitary part of it. So I'll let you get into that because, like I said, this is something that you've experienced personally yourself. So why do you think that abattoirs in Nigeria pose a threat to public health and the environment?
First of all, we need to know the purpose of an abattoir and what an abattoir is. An abattoir is a government-approved area for slaughtering of animals, and the purpose of having an abattoir is to ensure that only wholesome meat gets into the market. And the abattoir allows meat to be inspected and go through the right procedures before it gets into the hands of the consumer. And now the problem here is we are having abattoirs that are producing meats that are not hygienic because of the way things are run there. In Nigeria, for example, some of these abattoirs, they are not adequately equipped. The facilities are deteriorating. There's no adequate inspection. There's no proper enforcement of regulations at the abattoir. Meats are being slaughtered in unhygienic areas. Or in the abattoir, there are things that are essential, they are key. For example, water, you need water, lots of water at the abattoir. So you find out that some abattoirs don't even have enough water. Some of them have to have like a well or reservoir for water. They don't have flowing water, and you need water when you are dressing carcasses. So not having adequate amount, not having good water supply is a problem. It's going to lead to production of meat that are not properly cleaned, and then this kind of meats are not hygienic. They are not wholesome. The idea is to get wholesome meat. You need adequate lighting. You need these butchers to be adequately trained. You need them to be well aware of the risks of not properly dressing your meat, not properly handling this meat. So in some parts of the country, you have abattoirs that are not supervised properly. You have abattoirs that are not regulated. You have abattoirs that are not government approved. Remember, it has to be a government approved place. They are not government approved, so there's no proper supervision. So and animals are being slaughtered on dirty floor. They are dressed on dirty floor. They are cleaned with washed with dirty water, and things like this contaminate the carcass and then gets into the hand of consumers, and you start to have problem of foodborne diseases like cholera, like tuberculosis in abattoirs where meats are not properly inspected. They are not before getting out of the abattoir. You have some abattoirs where they don't have enough veterinary hands to ensure that only healthy meats are being allowed. At the abattoir, you have the ante-mortem inspection, you have the post-mortem inspection. Now, the ante-mortem inspection is the inspection done before the animal is being slaughtered. You need to check if this animal is even fit for slaughtering. Is it even fit for consumption? You check the animal for diseases that can be transmitted. So these animals first are stored at the lairage in the abattoir. So some abattoirs don't even have lairages. Some abattoirs lack lairages, so animals are just brought directly into the slaughterhouse. They are not inspected at the lairage. There's no ante-mortem inspection, and this is bad. You need to Animals have to be off certain medications days before they are being slaughtered, and these things are not recorded. Animals are just marched into abattoirs without regulation, and things like this. This is why we are having some of these issues of antibiotic resistance, even in human being, because you have antibiotic residues in animals, and then humans consume these kinds of meat, and then you start having antibiotic resistance in human beings too. So it's really, really important to address these issues to ensure that these things are tackled, because our meat has to be standard enough for consumption. Right now, our meats are not standard enough for consumption. Some are even transported in dirty vehicles to meat markets. They are transported on bike, open, exposed to contamination, and then they take these carcasses to meat markets where they are even exposed more. Flies perch on these carcasses, and it's just not good for our health. The
So is
meat
it
is
safe then to say that um, the meat that people are eating is slowly killing them?
Yes, it is. It is. We are not. So it is the reason people are not really aware or focusing on this area is because they don't. We have become complacent. We have become. We don't care really. We don't even. You cannot even tell. People are not even aware that you can be, get certain diseases from consuming these kinds of meat. Something like helminthosis, worms, these tapeworms,
Mm-hmm.
flatworms, that you can get them from meats that are not properly inspected. You can get them from consuming meats that are not properly cooked. So
Yeah, so I just want to make it clear that, Dr. Amosu is based in Nigeria, and everything she's talking about is her experience in Nigeria, right? So
yeah.
that we're not generalizing, like, everything is specific to where she's located, which is Nigeria. So I know you probably touch on this already, but I just want you to elaborate more on this, like, what are the, based on your own experience and as a vet, so what do you think are some of the factors affecting meat workers' delivery of good, hygienic, and sanitary meats in Nigeria?
Okay, some of these factors are: number one, the condition of the environment, the facility provided for slaughtering of meat. Some of these facilities are not ideal for slaughtering of animals. They don't have good waste disposal units. They don't have good water supply. They don't have good lighting. So the animals are slaughtered on floors that are not hygienic. You have blood-stained floor that are not properly disinfected before the next day. Another thing is poor hygiene of the butchers themselves. They don't care. They slaughter these animals with their bare hands, no gloves, no aprons. And you even find somebody clean their nose and then touch animals that they are slaughtering. It's really sad, it's bad for our health. And then um, they know, some of these butchers, they know, but they have developed indifference. They know that some of these meats, they are not good for consumption. Some of them sneak it out of the abattoirs, like abattoirs that have good regulations. They still have issues with butchers who sneak bad meat out of the abattoir because they are now indifferent to it. They don't care what it's going to do to their health. Like they just grow indifferent, and then they are not properly enlightened. Some of them are aware, some of them are new into the system. These ones, they need to be properly enlightened. There's a lot we can achieve through educating people, letting them know the effect of the things that they do. And if we are able to do this, we are going to curb some of these problems of poor meat hygiene.
Okay. So now that's a very valid point, and I'm going to come to some of the points that you made, now. But again, I wanted to, bring this up. Like, how does poor meat hygiene now? Because you talk about like, lack of training, lack of, properly educating some of these workers, right? Like it's affecting them in terms of, bringing good hygienic meats, to consumers' table. So now, how do you think, this poor meat hygiene affects workers and consumers, physical and mental health?
Number one is our environments are affected. This in an abattoir where you have poor waste disposal, where they just some dispose the offals, the content, the ruminal content in an open space. Now flies will perch on these things, and then they come back to perch on people's food, meats that are being sold in these abattoirs, and thereby contaminating our food. And then they contaminate our food. People eat the same kind of food. The false area is people are not aware. But if we can enlighten them, if we can show these things to them, then they become more conscious of what they are buying. So they become more conscious of where they go to get their meat. When they go to an abattoir and they see that a particular abattoir and they see the way they process their meat, because they have been informed, they can make good decision on deciding whether or not to patronize that kind of abattoir. I don't know if I answered your question.
Mm-hmm. Okay, so now, based on all of this now, so what are your own professional recommendations, from your own point of view, like, as a vet and as someone that actually worked, as a meat inspector. So what are your recommendations concerning these issues? Because this is a public health, issue that's affecting lots of people, so we need to bring awareness to this issue, so that we can get something done, in terms of, whether it is proper inspection, proper regulations, or whatever it is that needs to be done, to bring awareness to this issue. So what are your own recommendations based on these issues?
Okay. I would recommend that the government and regulatory bodies have more stringent rules, have follow up on these regulations. There are standards for abattoir operations. They're everywhere. You have standard for abattoir operations. So they need to ensure that these things are being adhered to. We cannot relax and just watch people do what they want to. We need to apply pressure to ensure that people actually follow the laid down routes. And then another thing is you need to provide good facility for slaughtering animals. You need good facility where there's adequate water supply, there's good lighting, there's proper disposal units. You have cold rooms where you can store this meat, and then you have good transport services where meats that are being taken to probably live markets are stored in cold chain, in vehicles that have cold rooms, and in a very hygienic condition. This will go a long way in reducing the amount of contaminants we'll have in our food. And then another thing is we can start looking at, in my region here, we can start looking at better ways to sell meat in meat markets rather than keep meat in open tables, in open areas where the meat is exposed to different kind of contaminants. We can start considering the use of shelves, the use of nets to prevent flies perching on our meat. And another thing is we can do more in training our butchers, train the butchers, train abattoir staff, train public public health individuals, employ more. We need to ensure that abattoirs that don't have enough hands, enough public health officers in their abattoir are, they make sure that they employ more so that they can supervise the activities of these people. They can also help in educating these people at the abattoir so that we can get good, wholesome meat from our abattoirs.
So would you now recommend, based on what you said, I think, you have suggested some excellent points. And I hope and I pray that somebody who's watching this video can just impact, such changes that because this is like, it's not hard to implement. But, I just wanted to ask, like, do you think it will be too much asking if, like a meat butcher, those people that work in abattoir, like, go for some specific training, they have to have some certifications before they get hired. So this way we know that, oh, they're well trained. Is that something that you think is feasible and possible to do in Nigeria?
Yeah, it is possible if we want to. If we decide that we want better meat, then we take conscious actions. We take steps in ensuring these things because they are actually necessary.
Yes.
We need it. They are necessary. It's not an issue that you should take with levity because a lot of people are falling sick, and because we don't have good data like from that would help us know that these things are coming from the kinds of meat consumed in the market. So we don't really know that these things are actually happening, but they are happening. So if the government can make it a necessity that whoever is to become an abattoir, to become a butcher, like has to go to through a particular training, regulatory bodies should enforce this. We have laws, we have rules guiding abattoir practices, but we need proper enforcement. So if we can enforce these things better and then regulate establishments of inappropriate abattoirs, go around, check places where they have mini slaughter slabs that are not according to recommendation, and shut them down. It would help, and these people can be directed to the central abattoirs. They can build a better facility for them in that area if there is need. But then they need to go around and check that these people are actually doing the right things in these abattoirs.
Yes, yeah, I think you summed it up perfectly. And I think everything now relies on the public health system in Nigeria and the federal or state government, in terms of making sure the regulations, intact, and also like, proper inspection of meat before they get in the hands of consumers, So because, yeah, go ahead.
right now we have some abattoirs that are actually following these guidelines.
Mm-hmm.
We have very good abattoirs following these guidelines, and if you see the kind of meat produced from these places, you want to go back and get. So I believe that we can do more. We can do more. We can push for more.
Okay, so basically there are some there, but it's just not consistent across
It's
the
not
whole.
consistent.
Yeah, it's not consistent. So we need consistency. So hopefully, you talking, and I'm sure that people that are passionate about this, bringing light on this issue, awareness on this issue will get attention of someone. And I hope that someone is listening, and we can make that changes, because we are talking about this a threat to public health, and
Yeah.
so something needs to be done, as soon as possible. So I want to thank Dr. Amosu for joining me today on this to discuss this topic, to share insights, and expertise on this issue. So thank you so much. I really appreciate you coming on the show today.
Thank you for having me.
Yeah, that was Dr. Amosu talking about poor hygienic and unsanitary abattoirs in Nigeria, which is a threat to public health and the environment. So I want to thank her again for joining me to shine a light on this issue, and talking about it from experience, and as a vet, what she has seen behind the scene. And hopefully, we'll get to bring her back one of these days so she can give us updates on the issue on the ground. So thank you guys so much for joining me. I'm Dr. Bidmos with Public Health Talks. And until next time, continue to practice these preventive measures in place and follow the CDC guidelines on COVID. So until next time, thank you so much, and have a great day. Bye-bye.